Can we just start by asking you, how will digital technology help ensure a sustainable future for care home operators in a post-COVID environment?
Cool. COVID-19 is likely to be here for the long term, and care home operators are really going to face a challenge to make sure that homes continue to be a safe place to live and a place where they're going to receive that quality of care that residents both need and deserve. I think technology and digital solutions are going to be key to the sustainability because they enable a proactive approach to have early responses. Reducing staff pressures is going to be really key, and they enable them to put care providers to raise the quality of the care. Should further outbreaks occur, I think technology is really going to be there to assist with the detection and formulate a response to hopefully then contain and trace the spread of the infections. Technology really has a role to enable effective communication, both on a daily basis between the sort of teams working in the homes, through to the management structure, management team, and engaging with others involved in the care, such as relatives or other healthcare professionals. One of our operators, David Crabtree, he's reported that digital care planning and having a relatives portal has been key for him getting admissions into the home following COVID-19, so that they can provide reassurance and transparency, so that the prospects can see that they are in control, they're in a safe place, and without technology, he wouldn't be able to demonstrate that. And its care homes are going to need to demonstrate that there are safe places to be, and they can continue to provide that quality of care and the positive outcomes that residents are looking for. And it's a safe place to work, with adequate protection measures.
Yeah, I guess as you say, it'll start to open up again, hopefully, to the families and friends. I guess ensuring that they are safe environments is a big. There's going to be a big theme going forward for care home operators.
Yeah, I think visibility of what's happening is really key to that. So sort of by having that data that really only technology can provide, being able to pick up an early symptoms, early signs means they can put their plans into place, whether that's to self-isolate that individual, whether it's to prioritize PPE, whatever their response plan is. The quicker they do it, as we've seen, the quicker you contain it, the more benefit it's going to be.
That's great, Andrew. Yeah, and what about the operational and financial pressures operators are facing? How can digital help with that, while also ensuring that providers continue to raise care quality?
So obviously the sector faces a massive challenge in the wake of COVID-19. Care homes have certainly been grabbing the headlines, and there's no doubting what impact coronavirus unfortunately has had. Care homes are a vital part of the health and social care network, and those living in care homes need the support, and staff working in those settings have really shown that they're willing to go above and beyond to provide that best quality care in difficult circumstances. I think as we look to the future, the government needs to be providing support to care homes, and I hope they start to value the services and support they provide on the same stature and equal value that we place on health services and hospitals. Operators have seen a significant increase in pressure on their staff and their team, increase in costs, additional costs around infection control, agency usage, all driving up the costs and reducing the margins. There's funding shortages, and with a widespread drop in occupancy, really threatens the existence of these services, which are key to health and social care, and the businesses have gone, these lots of vulnerable people at risk, or maybe not going into care homes because they don't think that they're safe. So there's a lot of pressure there now. Digital platforms and technologies need to be an enabler of that quality of care, enable us to deliver things efficiently and in different ways. We need to diversify and change care models. digital will give that insight and the understanding to what's happening on a day-to-day running of that service, highlight trends across the industry. So things like benchmarking, all of that is only possible through the power of digital. And as I said before, diversify the way the services are delivered that enable a safe and effective operational model.